Continuation of the pediatric congenital disorders, obstructive blood flow disorders, coarctation of the aorta, pulmonary stenosis, and aortic stenosis. Coarctation of the aorta. Description. Coarctation of the aorta refers to a narrowing of the aorta, usually near the ductus arteriosus insertion site, leading to decreased blood flow to the lower part of the body and increased pressure in the upper body. Symptoms: high blood pressure in the upper extremities and reduced blood pressure in the lower extremities. Weak or absent femoral pulses in comparison to brachial pulses, heart murmur, headache, leg cramps, and dizziness in severe cases. Diagnosis: physical examination may reveal differences in blood pressure and pulses between upper and lower extremities. Echocardiography, MRI, or CT angiography confirms the diagnosis and assesses the severity of the coarctation. Medical treatment: blood pressure management with antihypertensive medications. Prostaglandin E1, PGE1, infusion in critical cases to maintain ductal patency and improve lower body perfusion. Surgical treatment: primary repair involves surgical resection of the coarctation segment and end-to-end anastomosis. Balloon angioplasty and stent placement may be performed as an alternative or adjunct to surgery. Nursing management: monitor blood pressure differentials, peripheral pulses, and signs of heart failure. Educate patients and families about medication adherence, blood pressure monitoring, and signs of complications post-surgery. Pulmonary stenosis. Description: pulmonary stenosis is a narrowing or obstruction in the pulmonary valve or pulmonary artery, restricting blood flow from the right ventricle to the lungs. Symptoms: depending on the severity, symptoms can range from asymptomatic to cyanosis, dyspnea on exertion, fatigue, chest pain, and syncope. A systolic ejection murmur may be heard on auscultation. Diagnosis: physical examination may reveal a harsh systolic murmur over the left upper sternal border. Echocardiography confirms the diagnosis, evaluates the degree of stenosis, and assesses cardiac function. Medical treatment: monitoring for progression of stenosis and associated complications. Medications may be prescribed to manage symptoms such as beta blockers or diuretics in cases of heart failure. Surgical treatment: balloon valvuloplasty to widen the stenotic valve. Valve replacement or repair in severe cases or when balloon valvuloplasty is ineffective. Nursing management: monitor for signs of heart failure, cyanosis, and exercise intolerance. Educate patients and families about the condition, medication management, and follow-up care post-intervention. Aortic stenosis. Description: aortic stenosis involves narrowing or obstruction at the level of the aortic valve, impeding blood flow from the left ventricle to the aorta. Symptoms: asymptomatic in mild cases, but severe stenosis can lead to chest pain, dyspnea, syncope, fatigue, and palpitations. A systolic ejection murmur is characteristic, often radiating to the neck. Diagnosis: physical examination may reveal a harsh systolic murmur heard best at the right upper sternal border. Echocardiography confirms the diagnosis, assesses valve morphology and function, and evaluates for associated cardiac abnormalities. Medical treatment: monitoring for progression of stenosis and symptoms. Medications such as beta blockers or calcium channel blockers may be prescribed for symptom management. Surgical treatment: valve replacement, mechanical or bioprosthetic, in severe cases or when symptoms are refractory to medical management. Balloon valvuloplasty may be performed as a temporary measure in select cases. Nursing management: monitor for signs of heart failure, exercise intolerance, and complications such as arrhythmias or endocarditis. Educate patients and families about the condition, medication management, signs of worsening symptoms, and post-operative care if surgery is needed. 3 congenital heart defects that result in mixed blood flow: transposition of the great arteries, TGA, truncus arteriosus, and hypoplastic left heart syndrome, HLHS. Transposition of the great arteries, TGA. Description: TGA is a congenital heart defect where the aorta and pulmonary artery are switched, leading to parallel circulation with separate systemic and pulmonary circulations. Symptoms: cyanosis is the primary symptom due to the parallel circulation, resulting in deoxygenated blood bypassing the lungs. Respiratory distress, poor feeding, and heart failure symptoms may also occur. Diagnosis: physical examination may reveal cyanosis, a single loud S2, and absence of a murmur or a murmur related to associated defects. Echocardiography confirms the diagnosis and assesses associated abnormalities such as atrial or ventricular septal defects. Medical treatment, prostaglandin E1, PGE1. Infusion is initiated to maintain ductal patency and improve mixing of blood until surgical correction. Oxygen therapy and medications to manage heart failure symptoms. Surgical treatment, arterial switch operation, JTEEN procedure, is the definitive surgical correction, where the aorta and pulmonary artery are switched back to their correct positions. Palliative procedures may be needed initially, such as atrial septostomy to improve mixing of blood. Nursing management, monitor oxygen saturation, signs of cyanosis, and heart failure symptoms. Educate parents about the condition, medication management, and signs of complications post-surgery. Truncus arteriosus. Description: truncus arteriosus is a rare congenital heart defect where a single large vessel, truncus, arises from the heart instead of separate pulmonary artery and aorta, leading to mixed blood flow. Symptoms: cyanosis, poor feeding, failure to thrive, and respiratory distress. A systolic murmur is often present due to the high flow through the truncus. Diagnosis: physical examination may reveal cyanosis, a harsh systolic murmur over the left upper sternal border, and signs of heart failure. Echocardiography confirms the diagnosis and assesses associated abnormalities such as ventricular septal defects. Medical treatment, prostaglandin E1, PGE1, infusion to maintain ductal patency and improve systemic blood flow. Medications for heart failure management and oxygen therapy. Surgical treatment, complete surgical repair, involves creating separate pulmonary and systemic circulations with patch repair of the septal defect and reconstruction of the aorta and pulmonary arteries. Nursing management, monitor oxygen saturation, heart failure symptoms, and signs of infection post-surgery. Provide support and education to parents regarding the condition, medication administration, and post-operative care. Hypoplastic left heart syndrome, HLHS. Description: HLHS is a complex congenital heart defect where the left side of the heart, left ventricle, aortic valve, and aorta is underdeveloped, resulting in reduced systemic circulation and mixing of oxygenated and deoxygenated blood. Symptoms: cyanosis, poor feeding, rapid breathing, weak pulses, and signs of heart failure. A systolic murmur may be present due to associated defects like atrial septal defect or patent ductus arteriosus. Diagnosis: physical examination may reveal cyanosis, weak pulses, and signs of heart failure. Echocardiography confirms the diagnosis, assesses the degree of left heart hypoplasia, and evaluates associated defects. Medical treatment, prostaglandin E1, PGE1 infusion to maintain ductal patency and improve mixing of blood. Oxygen therapy, medications for heart failure management, and careful monitoring of fluid balance. Surgical treatment, a series of staged surgical procedures known as the Norwood procedure, Glenn shunt, and Fontan procedure are performed to reroute blood flow and improve systemic circulation. Nursing management, monitor oxygen saturation, signs of heart failure, and complications such as arrhythmias or infections.